A bunionette, also known as a tailor's bunion, is a bump on the outside of the foot. So when we look at the model, a bunionette typically occurs on the fifth toe, or on the outside toe, at the base of the toe, and is the exact reverse of a bunion. A bunion occurs on the big toe, whereas a bunionette or a tailor's bunion occurs on the little toe. And when that occurs, what happens is that shoe wear or genes predispose you to developing tilting of that fifth toe towards the smaller toes adjacent to it, causing the prominence of the metatarsal to become greater. So this big bump right here becomes bigger as that toe starts to tilt away from that bump. This is something that many people are born with because of the way your foot is constructed, so the genes play a big role on this. But in addition, if you have tight toe box shoes or fashion shoes, they tend to push that toe in, making that much more prominent. Another example of a shoe that can cause this can even be a cowboy boot, which has a narrow toe box because it causes tilting of that toe to come in. A bunionette is very similar to a bunion. If you have a bunionette, your pain is going to be, and you'll know you'll have it because you'll have pain right over that area where that bunionette occurs. And it can be red, it can be swollen, and they can also cause sometimes calluses or thickening of the skin over the area where that bunionette developed. When you have a bunionette, you can treat this at home initially, and the appropriate way to treat it at first would be to try to adjust your shoe wear so that you don't get friction on the area where the pressure is. So a wider or deeper toe box shoe is what we generally recommend when you recognize that you've got this condition. In addition, you can look and find either online or at the pharmacy spacers or toe spacers made out of foam or silicone that can go between the toes, and then you'll separate the toes in that area to reduce some of the friction on the side of the toe. In addition, corn pads, some types of cushion pads that you can also find will also reduce pressure on the area where that bump occurs. Now, if all of these treatments that you've tried at home are not effective, then it's appropriate to see a foot doctor for this condition. When you see your foot doctor, he's going to try some of the same things. He'll also consider using pads. He'll look for wider toe box shoes, maybe refer you to a shoe repairman or a cobbler to stretch out the shoe over the area where the pressure is occurring. If these things aren't effective, then ultimately surgery is the best way to be able to treat this. In surgery, what we typically do is remove the bone on that side of the toe. So we make a cut across the bone and take away the pressure, and the incision for that might be on the side of the toe, or it might be on the top of the foot in that area. And when we do that, we remove the bone, and then we also cut the bone and shift it in and tighten up ligaments on the outside, and sometimes release ligaments on the inside to bring that toe from being outwardly pressured to pull it out against the shoe a little bit more, and then to take pressure off of the bump. Surgery is effective between 92 and 95% of the time, which is very similar to bunion surgery or correcting conditions on the opposite side of the foot. We usually see a recovery process that takes about 3 months, and swelling can last for 3 months or even longer after any type of foot surgery. The bunion correction usually means wearing some type of a hard sole shoe or a boot or cast for the first 2 weeks, and even pushing that out to about 6 weeks. But effectiveness is great, and if appropriate and if recommended, then reconstruction is very effective for bunionettes.